Y'all have a good day today?
Yes, sir.
Guys?
All right, seems like a nice family man here.
All right. Hey, high fiver, huh?
I am Louis Medar. I am 70 years old.
It looks like he has a lot of sun damage to his face here, and it looks like it's all dry, like he's not really taking care of himself too well.
And I have an unknown skin disease. I have a lot of pain with it because it scales up. I have open splits, and it's a constant pain that I just sort of learned to live with.
Ooh.
Pull it up. And sheets like this.
Wow, that's impressive. Look at that.
So, and this is how it does all the time.
Wow, it looks like sheets of paper he's pulling off there.
Arms and my legs and my feet are the worst.
Look how dry that is. I don't think he's used moisturizer in years.
10. The pain on my feet is
Wow.
9 or 10.
Wow, that looks really bad. His face is dry, everything's dry. He needs to start taking better care of his skin and probably should have a biopsy taken to see what's really going on there.
I spent 2 years in Vietnam War. After Vietnam, I was compelled to want to still serve my country, and I felt in my 30s, I'm still young enough to
Wow, it
keep
looks like
going.
this condition happened later in life here.
Oh, yes, this is my Class A jacket.
After I came back home, my skin started curling up on me. I started to get in these heavy-duty gashes down my feet. This skin condition kept getting worse and worse. I believe there was chemicals in the atmosphere while I was serving over in
That's
Kuwait.
true. I don't know of any other Army people coming back from Kuwait having this problem. Maybe there are, I don't really know, but if there are, then it's a definite possibility. But if he's the only one having this, then the likelihood of this actually happening from Iraq or Kuwait is pretty minimal.
This is my medical records that I had faxed to me from the VA center.
I hope Dr. Lee, she might be able to tell me just exactly what I got.
All right, so he's seeing a dermatologist. That's the first step on the road to recovery.
Me.
Nice to meet you. So let me ask you, what's going on here? Let's start from the beginning here.
Yes, ma'am. I have a skin condition.
Okay. When did it start?
Well, it started back when I was overseas for Desert Storm. They had the burning oil wells.
So your exposure to these chemicals may have triggered this, is what you're saying then?
Yes, ma'am.
Okay. I take your socks off here now.
Yes, ma'am.
Yeah, I see. Look at that. This is way beyond athlete's foot or regular dry skin. I mean, this is scale upon scale upon scale. He has toenails that are half an inch thick. I don't know, I'm gonna just have to try to figure it out.
Yes, ma'am.
Does that hurt you at all?
No.
I don't want to pull too hard. There
Yeah,
you go.
usually,
Look at
yeah.
that hard little plate of skin. I mean, look, you could use that as writing paper. It's really difficult to treat Louis's scaly skin if I don't know what's causing it in the first place. I'm certain that I'm going to need to
You
consult
definitely need
with
to make
some
a
other...
diagnosis first to try and help him. But in the meantime, you can do a few things to treat him to get rid of his dryness and his pain.
Board-certified dermatologists really get their opinion. I'm gonna do something called a punch biopsy. We want to take the surface of the skin and just a
Good,
little bit
reliable
underneath
thing,
to...
taking a biopsy to get the answer of what's really going on here.
Usually if you want to detect inflammatory skin conditions, we take a punch of skin, so that's not just
So
taking
that
the
looks like a
surface
2
of
or
the
3
skin.
millimeter punch. That's a good enough size, which should give a definitive idea of what's really going on here.
Is very much like taking a straw and taking a core out of a cake. You can pull it out and see all the layers of the cake and what's inside. Take a bunch of Vaseline, put it on your foot here. And we're gonna put this wet sock on here to keep the moisture in, and we don't want that to get dried out. We're gonna kind of give you a light wrap just to keep it in place.
He needs consistent skin management to significantly improve the appearance of his skin. Hydration of the skin is critical in this case.
Louis and Jacob need to stick with this regimen. I think that if they notice an improvement in his legs and the scaliness of his legs, I think he's going to be able to move around better, he's gonna feel better, and that's only gonna be
So management of this would be soaking to loosen all that stuff up, then exfoliate to gently remove the heavier stuff, and then moisturization is just critical with enrollments, ointments, ideally within 2 minutes to seal in the moisture. And then wrapping it up, other things you can do basically peels, like a light alpha hydroxy peel. Urea also can help bind moisture to the skin.
It's not good. I mean, there's a true potential that this problem in his legs could threaten his life. So how does that look?
I can definitely handle that.
Yeah, I'm sure you can.
Oh, I feel wonderful. The mystery's still lingering like this, but she's giving me new hope.
Look at who we have here.
Well, hi, Dr.
Hi.
Lee. Oh.
Nice to see you again. It's
So you
been
can see
a
on his face
while.
he's using a lot of moisturizer, so his complexion is greatly improved.
Louis is back today. I really hope that he has done some work to make his legs
So on the side of
look
his
better.
face, you could still treat those seborrheic keratosis that's on his temple areas and forehead, and in his glabella around the 11 lines here.
The dermatopathologist read this as an ichthyosis condition. Ichthyosis means skin that has this sort of fish or plate-like scale on it, really thickened, dry skin. Louis feels really strongly that his ichthyosis has to do with his war deployments. But I think a lot of it also has to do with the fact that he just didn't know how to take good care of his skin. And no one really maybe took the time to kind of explain.
He's really got to soak, exfoliate, and moisturize every day. I would recommend he does it twice a day.
So let's take a look at your foot here. But look at that scale, looks a lot better.
It looks like it's not dry now. It does look somewhat improved. I wouldn't say a lot better because he's got a long way to go. He's got to stick to his daily routine, and he should see more significant improvement in a few months.
Oh, man.
It looks a lot better. Look at that.
Better than I've ever seen it.
Your feet look spectacular.
Yeah, I don't think I've seen his feet pink in over a decade.
When I first met him, he sort of had given up and he didn't really know what to do. And I kind of suspected that maybe if I gave him something really concrete to do, that it would help improve things. But
You really need
was
to
all
teach
up to him.
patients to take care of themselves so they become healthier.
Feel like we're giving you the tools to make it better.
Oh, it feels good.
Yeah, it does. And so you think you're going to be able to continue doing this too?
Oh, yes, ma'am. I know I
So there you have it, a
continue.
severe case of severe dry skin ichthyosis. So if you like these type of videos, hit the subscribe and like button and there'll be more on the way.